goal of cataract surgery is improving your vision, but if left undetected, a condition called Meibomian Gland Dysfunction, or MGD, could limit the effectiveness of your surgery. MGD is a chronic and progressive condition caused by obstruction of the Meibomian glands. It has been shown to be a root cause of dry eye in 86% of cases. This obstruction diminishes the quality of the tear film layers, which then fail to protect the surface of the eye and can lead to uncomfortable dry eye symptoms. Studies show that a surprising number of cataract surgery patients have MGD, up to 52%, and many of them don't experience any symptoms. Having cataract surgery without treating MGD first can keep you from achieving the vision you are hoping for and can trigger new or worsening MGD symptoms. Global medical recommendations support MGD treatment prior to surgery, so even if you don't have dry eyes, ask your doctor to screen you for MGD today. MGD is diagnosed by evaluating the function and structure of your meibomian glands. Meibography imaging can give a good indication of the current state of your meibomian glands and whether you are showing signs of MGD. Fortunately, there is a simple and effective way to treat MGD and prepare the ocular surface for surgery. One treatment may be all it takes to remove gland obstruction and achieve clinically proven relief of dry eye symptoms that lasts through cataract surgery. In a clinical study, patients treated with LipiFlow prior to cataract surgery had significantly improved meibomian gland function and reduced dry eye symptoms after surgery compared to patients who did not receive treatment. It has over 10 years of clinical research and over 30 peer-reviewed reports demonstrating its safe and effective treatment of MGD.